Hello, welcome to the Diagnostic Imaging Center. This is the part of the hospital where kids come to get a CT scan. CT stands for computerized tomography. CT scans are pictures that are taken with a large, special camera called a CT scanner. It takes pictures of the inside of your body. When you come for your CT, you will meet many new people and have some pictures taken with a special camera. But just like a regular camera that you may have at home, this camera won't touch you and it won't hurt when it takes pictures. CT scans can be done for many different parts of the body, such as the head, chest, stomach area, or even arms or legs. Your doctor will decide which part of your body needs CT pictures. Do you know which part of your body is having CT pictures taken? When you first arrive, you will check in at the desk in our waiting room. The receptionist will give you a wrist bracelet that has your name and birthday on it, and some paperwork for your parent or caregiver to fill out. After your paperwork is done, you may have to wait in the waiting room for a little while. This is a good time to play, watch a video, or just hang out with the people who came with you. You may bring a toy or an activity from home to do while you wait. Some ideas are a tablet, a small art project, a toy, or your homework. While you are waiting, a child life specialist may stop by to meet you. A child life specialist's job is to make sure that you understand everything that will happen while you are at the hospital and help answer any questions you may have. You can also ask the receptionist to page your child life specialist if you want to talk about your CT scan. It's really important to hold very still while we take your CT pictures, so we may give you a sleep medicine called Anesthesia. This medicine helps you fall asleep and hold still during the CT scan. It is usually given through a tiny, flexible tube that looks like a straw. This is called an IV tube, and it goes into your vein, usually on your arm or hand. If you will get sleep medicine through an IV tube, it is important that you don't have anything to eat after midnight. You may have clear liquids up to 2 hours before sedation. You'll also go to the Child and Adolescent Center to have your IV tube placed before you come to the CT area. You can talk with your nurse or child life specialist if you want to learn more about the IV tube. When it's time to get ready for your pictures, the CT scan team will call your name and walk you and your parent or caregiver to another waiting area. Here you will meet a nurse who will ask you and your parent or caregiver some questions. We will also give you a special pair of pajamas to wear. If you have an IV tube, your nurse may say she's going to flush it. This just means she's going to check and make sure it works well by putting special water in it. Some kids think it feels a little cold. You will also meet the CT technologist, or tech. This is the person who will take your pictures. A doctor called an anesthesiologist and a nurse anesthetist are also part of the team taking care of you during your CT scan. It is their job to give you the sleep medicine that will help you to fall asleep during your CT scan. They will ask you some questions like, when was the last time you had something to eat or drink? Remember, you can't have anything to eat after midnight. You can have clear liquids up to 2 hours before sedation. When it's time to take your CT pictures, the nurse will walk you and your parent or caregiver to the CT room. The CT scanner is a large round camera with a hole in the center. It kind of looks like a spaceship or a giant donut. You will see a special bed that looks like a table. This bed moves in and out of the CT scanner. Remember, the CT scanner will not hurt and it will not touch you. The tech will help you climb up onto the bed and get comfortable, give you a warm blanket if you are cold, and have you wear a special seatbelt. The anesthesiologist will put some monitors on you to help watch your breathing and your heartbeat while you are sleeping. We will put a blood pressure cuff on your arm, some stickers on your chest and tummy called EKG leads, and a Band-Aid with a red light on your finger called a pulse oximeter. Once you are on the bed and comfortable, the anesthesiologist will give you the sleep medicine through your IV. You will start to feel very sleepy and will fall asleep quickly. Your parent or caregiver can stay with you until you fall asleep. When we are done taking your CT pictures, the anesthesiologist will stop the sleep medicine and help you wake up. You'll be in a different room and your parent or caregiver will be there with you. After you wake up, you can have a drink of water or juice or something to eat. When it's time for you to leave, we will remove your IV tube unless you have something else scheduled that day. Then you can change back into your regular clothes and leave. A special doctor, called a radiologist, will look at the pictures. This may take a little while, so you may not know the results on that day you have the CT. When the results are ready, the doctor will talk to you and your parents or caregivers. Now that you know what to expect with your CT scan, there are some things you can do at home to prepare for it. You can think about which parent or caregiver you would like to come with you on the day of your CT scan, and choose a special activity or a favorite toy to bring with you. Also, there's another video that we suggest you watch. It's It's about having a CT scan, but without anesthesia. Sometimes you and your anesthesia team may decide that you can do the CT scan without anesthesia. We will let you know ahead of time if your CT scan will be done with or without anesthesia. If you have any questions or worries, please talk with your medical team or your child life specialist. Thank you for watching.